Want to study in Germany? Then Excella is the best option. Admissions with scholarships available. Call 9881 96666.
కమల్ గారు నమస్తే.
నమస్తే అండి.
సార్ ఈ కాన్జనైటల్ హార్ట్ డిసీజ్కి ఇండియాలో ఎటువంటి ట్రీట్మెంట్ ఉంది?
So this question is quite important and relevant at this point. Like, what is the status of treatment of congenital heart diseases in our country? Like we all know, like we are lagging behind the West in the treatment of congenital heart disease. And if you see our history, the changes in congenital heart disease treatment has occurred in just last 25 to 30 years, whereas the West had started the treatment 50 years back. But now in our country, we are well equipped to do all the major surgeries. We are doing cath lab interventions and medical management of more than 99% of these congenital heart disease. So let's talk about how can we manage this congenital heart disease. Like if a child is diagnosed with a congenital heart disease, what are the different treatment modalities? So first of all, the symptoms of the child which the child is having is palliated, like is managed with medical management. But medical management is useful to a certain extent also. It cannot treat the congenital heart disease. The medical management basically is to support the heart. They will, because the heart is under stress, under load. So we give medicines, drugs, so that the heart load on the heart decreases. So medical management has a limited role in congenital heart disease. Second, we will talk about surgeries. So most of the congenital heart disease, I should say up to 50 to 60% of the congenital heart disease are treatable by surgeries. So these surgeries, like what they do, most of them, surgeries can be of two different types. They can be an open heart surgery in which the chest is open, the heart is stopped so that the surgeon can work on a stopped heart. And meanwhile, as the heart is stopped, the perfusion, the blood to the different parts of the brain, including brain, kidney and different organs, vital organs, is taken care of by an outside artificial pump which is known as cardiopulmonary bypass machine.
Okay.
Because as the surgeons are operating, they cannot operate on a heart which is moving constantly. So they need to make the heart still. So at that time, they will stop the heart, operate on it, then stitch the heart, come back, stitch the chest. This is called as open heart surgery. Some of the surgeries can be done by these surgeons from the lateral chest also, in which they do not need to stop the heart. They will go into the, like these surgeries are mostly done for vessels, different vessels which come out of the heart. Like if the vessel is narrow or some additional vessel known as PDA is there, they need to tie it. So in those cases, they can go from the lateral thoracotomy, we call it in our terms. So they can go and tie it there and come back. In this case, the heart does not need to be stopped. So these are the modalities of surgery which are needed. Normally, before surgery, we need to screen the patients. Their common blood tests and all, everything is seen. Other anomalies are ruled out. The child should not be having any other problem before the surgery. And normally, after the surgery, we keep the child in ICU for approximately 1 to 2 days. And after the child is stable, we send them for ward for 2 more additional days. And by day 4th and day 5th, the child will be fit to go home. They are allowed to do like limited activities for the initial 15 days, and after that most of them can resume their normal activities and vaccination. The third modality of treatment, which is done not by the surgeons, by us cardiologists, is cath lab interventions. By cath lab interventions, we do the interventions like there is a hole in the heart. There are different types of holes in the heart. We call them as atrial septal defect, ventricular septal defect, patent ductus arteriosus. These are different names. These are amenable to be closure with button, which are called as devices, in which we do not need to open the chest. We will just go through a vein in the leg. Our tubes and pipes will go to the heart, and we will put a device there, which is a button. We will put it, and after that button closure, we just need to keep the child for observation for the next 24 hours. And after that, the child can go home and resume his normal activities from even 2 to 3 days after that. So, and these button will be there in the heart lifelong. They will not create any issues to the, in most of the cases, to the children, and they can complete their normal life. So these are the 3 major modalities which are available not only in the West but in our country, and all the major surgeries and interventions are done in our country. If you talk to us now, we have more than 60 well-equipped centers in our country, and most of them are clustered in southern part of India, which are doing these surgeries and interventions. So these are the modalities which are mainly used for congenital heart disease.
థ్యాంక్ యూ కమల్.
Thank you.